Welcome, everybody. Thank you so much for joining us this evening. My name is Dr. Peter Gold, and I'm honored to be moderating tonight's discussion on physician wellness with this incredible group of Tulane young alumni. I'm joined with them as a 2012 and 2016 graduate from both Tulane undergrad and medical school. I also graduated yesterday from orthopedic surgery residency at LIJ in New York, and I'll be starting a fellowship in hip and knee replacements at the Rothman Institute in Philadelphia this summer. And I stay connected to New Orleans, working with community organizations, do a nonprofit called Strong City, which I helped start with other fellow Tulane alumni. Tonight, we will address some really important topics, and we'll cover burnout, self-care practices, and the stigma that exists between physicians and seeking treatment for mental health issues specifically. The only thing about this topic is that it's very important, not only to me, but to everybody else on this panel. It's something that I've struggled with and I've continued to try to prioritize in my day-to-day. Also, very recently, one of my mentors and colleagues in total joint replacements, Dr. Vijay Riskina, passed away this year tragically to suicide. This is a really important topic, and I'm really looking forward to discussing this tonight. Because we need to have these conversations now, and we need to continue to have this common topic discussed amongst us and amongst our peers. And if tonight's chat helps just one person make a change, seek help, or reach out to a friend that's in need, this conversation is worth our time, it's worth our effort, and it's worth our dedication. Before I introduce the panelists, I just want a quick reminder to please submit questions into the chat. We want this to be really interactive. Hear your questions. We'd love to have back and forth questions and answers with the panelists and with you all. If any questions aren't answered in the webinar, we will be able to answer them and send it to you guys after as well. So with that, it's my pleasure to introduce one of our panelists, Dr. Melissa Adrouny.
Thank you, Peter, and thank you all to Tulane for organizing this event. It's honestly a real privilege to get to participate in this. My name is Melissa Adrouny. I am a general practicing OBGYN in San Jose, California, which is where I grew up. I graduated from Tulane in 2012. I did a joint MD MBA degree, after which I completed residency in Fresno at UCSF. And then in 2016, when I graduated residency, I made my way back home, and I opened up my practice and have been chugging away ever since then.
Thanks, Melissa. Appreciate you being here. Next up, we have Dr. Travis Manasco.
Hi, everybody. Thanks, Peter. Congratulations. Nice to see everybody. My name is Travis Manasco. I am a Tulane medical graduate of class of 2013. And after medical school, I did an emergency medicine residency at Boston Medical Center and was a chief there. And then after 4 years there, went to St. Louis and did critical care medicine and graduated from fellowship in 2019, which was a very appropriate time to graduate from critical care medicine training. And then while over the past couple of years, I also have founded a biotech medical device startup and have been doing that days, nights, and some free time. I'm really excited to talk about this very important topic and very grateful for Tulane for having me.
Thanks, Travis. Next up, we have Dr. Christina Short.
Hi, everybody. I'm Christina. And you guys kind of have my bio in the email, but essentially I'm a double Tulane grad from 07 and 11. And I did my anesthesia training at University of Miami and then came to Houston at MD Anderson for a pain medicine fellowship. And that's what I do today. I'm a New Orleans native, born and raised, and Tulane's close to my heart. Very excited to be here.
Thanks, Christina. And lastly, we have, sorry, not last, second to last, we have Dr. Jerry Zabochiko.
Nice, Zifodya, perfect. That was well done. Hi, everyone. Jerry Zabochiko. I'm a pulmonary and critical care doc actually here at Tulane, so I'm back in New Orleans. I graduated with an MD and an MPH in 2013. I went away to Vanderbilt to do internal medicine, and then went to the University of Washington for pulmonary and critical care fellowship. Then spent a year doing a global health Fogarty fellowship in Kenya, and then came back to Tulane in 2019 and started as a pulmonary and critical care doc 4 months before the pandemic. So I've been deep into COVID for the last year and a half. Really glad to be here. I've dealt with some of these issues myself in the last year and a half, so I'm glad to talk about this important topic. Thanks for having me.
Thanks a lot. And Jerry is on call right now too, so talk about multitasking and doing many things at once is something we probably all struggle with. And lastly, Dr. Aaron Short.
Good evening, everybody. I can't say enough. It's quite a privilege to be a part of this panel. I'm really just very happy, pleased that we're discussing this very important topic. As my title suggests or shows, Tulane grad, undergrad, master's, medical school. I completed residency, University of Miami, Jackson Memorial Hospital program, fellowship at the Houston Veterans Affairs Hospital, Baylor College of Medicine program, stayed on as staff, still serve as a faculty member with Baylor for the Menninger Department of Mental Health. But the interest that I would share just in a few sentences, I remain active with electroconvulsive therapy, repetitive transcranial magnetic stimulation, and have a background in psychoanalytic psychodynamic therapy from the South Florida Psychoanalytic Institute. Again, it's just, I'm glad to be here. This is a great topic for us to discuss that's going to be part of the progress. And I thank you once more.
Great, thank you guys. And I'm glad we all got to have this conversation together. So like I said, we'll split this up into 3 sections. The first, we'll talk about burnout, then we'll talk about stigma, and then self-care. So jumping into burnout, Jerry, I want you to start off. How do you define physician burnout? And are there certain times in someone's career where you think that we're most at risk for burnout?
Yeah, so burnout is, the way I define it is just emotional and really work stress to the point where you feel like you can't do anymore and you're just completely overwhelmed is how I would describe burnout. And typically in a work environment, just feeling so overwhelmed, you don't think you can do anymore. I would say there've been 3 key points in my training and or career now where I was exposed to potentially burnout. One was intern year, just in January, February of intern year, in the midst of a snowy winter. Before, I'd never had snow before. I was somewhat burned out at that point. And I think it's common for people intern year. And then first year of fellowship, definitely felt that also. And then this, this last year, I'm 1.5 years into practice. I think that's figuring out who you are as a practicing physician is another just point where you're trying to do so much that you are at risk for potentially being burned out. So that's how I define it. And I think the 3 time points in my life where I felt it.
Does that definition resonate for anybody else? Does anyone think about it a little bit differently or have their own spin on it?
Well, I kind of think of burnout in the sense that, again, a lot of the same sentiment about feeling overwhelmed and feeling just so kind of pushed to your limits that you almost sort of lose a sensation and a wherewithal of yourself, in that you're not really able to control your emotions, and it comes out, unfortunately, in sometimes in really inopportune circumstances. And the one example that I think of is actually the community hospital that I practice at. Probably went viral. Many people may have seen it a few years ago. It was in the ER, and it was an ER physician who just clearly was having a rough night, and it involved a less than appropriate interaction with someone who was coming in that she just assumed was, chronic pain and pain seeking. But it was videoed and it went viral. And I actually, honestly, I had a really hard time bringing myself to even watch it. I couldn't watch it for a few days when it first sort of became viral, because I knew the minute I watched it that I was going to see someone who you could tell was just being so overworked and so stretched that she didn't even have the ability to step out of herself and see how just inappropriate she was being. And when I see stuff like that, it breaks my heart, because none of us got into medicine for these reasons. We all had very altruistic intentions, and to see someone kind of whose career really essentially was ruined after that, it kind of broke my heart. And I not excusing the behavior, but it was hard to watch, because you kind of see the humanity side of it, and that she wasn't in her right mind.
For those who haven't seen, or some people in the audience who aren't real familiar with it, can you give us a little brief of what kind of behavior she had and where it kind of left her career?
Right. Well, so it was a kid in high school, and he was kind of a frequent flyer for anxiety. And so, she came in and it was just kind of, almost mocking him, in the sense of, well, you're clearly, he's like, well, I can't feel my body. I can't move my arms. I feel crippled. And she was almost mocking him and saying, oh, you can hold your arm up. You're calm. And it just felt so icky watching it, because you could just tell it wasn't about that moment. It was more in her moment. She was thinking, I have so many other things going on right now, and so why is this becoming my problem right now?
Yeah. And I mean, Travis, being in critical care, this is your kind of your field, your specialty. And can you speak to burnout around you and your colleagues, and how something like this can happen in unfortunate but maybe too easy of a way?
Absolutely. And I echo what Jerry and Melissa said. And if you look at that ER doctor, what you see, and many of us have seen it, not just in ER, but in all different specialties, is a lack of compassion and compassion fatigue. Compassion is it is something that we all start off with, and hopefully all of us can continue throughout our career to have it, but it's something that needs to be replenished. It's something that needs to be recharged. And when you're on your 10th night shift because XYZ, and then you're at home and your kids are at home during the pandemic, you can see how I just said two things that I bet a lot of people's stress just went up. So night shifts and kids and all your other life things that you have going on. So while like Melissa said, I don't excuse it, I can understand it. And so to answer your question, Peter, and to kind of for both critical care, a lot of frontline critical care, and ER also, and then I'm sure a lot of people have it in really all their specialties, but the ER and critical care are just kind of never ending, especially the ER. When the ER, the ER, you have a waiting list. And so you're seeing a patient, but you're thinking about the stroke they just called, the trauma that's about to come in, the phone call that's waiting for you, the patient that is like kind of pacing outside the door that's ready to go home because of all these things. And you learn to balance those in training and deal with those. And really good ER doctors kind of develop an ability to handle all those, but all those things can weigh on you. And I could keep going for an hour. So I'm just going to stop and let other people talk. But yeah, absolutely.
Yeah, I want to stay with that just for one more quick question, because it's really interesting. You're a guy, you say you have multiple stressors going on at once, and you never know what's going to hit, and you could be on something that's high priority and another high priority comes in. So dealing with all that at once, that's kind of like the art of medicine for you guys. What have you done, or kind of practice that you put in place to try to balance that? Or have you seen a mentor that taught you something? What's important for that?
A lot of what's important to that, two things, and Jerry said it too, so intern year was, I think we all can agree, intern year was extremely stressful. And one thing that makes intern year or the first year in fellowship or the first year as attending is it's your first year. And so there's the lack of familiarity, there's the lack of medical experience. When you get that kind of feel of the culture of the hospital, of you get a little confidence in your medical decision making, you know who you can trust, you know how to get things done. That goes away a little bit. So once you get that baseline medical experience, medical knowledge, and ability to practice, that helps. And then I think the most important thing for those things are trying to stay as recharged as you can outside of work. So trying to make sure you're sleeping and exercising or playing with your dog or whatever it is that recharges you outside, so that you can come to work and be present.
Yeah, it's important. Christina, just diving into that example again, we talked about the stress on the ER doctor, but for you, you can kind of just mention again what your definition of burnout is, but then specifically thinking about the patient in this scenario, a chronic pain patient, someone that you're really familiar with, how do you keep compassion and keep compassionate when you have, that same story over and over and over again, and sometimes you may not, believe them as much, or you're tired and haven't worked out. I mean, how do you maintain compassion? Because it might be tougher for you than anybody else.
Yeah. So as Peter kind of hinted at, I treat chronic pain patients all day. So this is definitely something that I see, Melissa, and I feel for that ER physician. So burnout to me means emotional exhaustion. It means, it's hard to keep going, to say, how can I keep doing this, because it's just wearing me down every day, right? When it comes to dealing with it with chronic pain patients, the way I try to look at it is, what if this was my family member? How would I treat this patient? And that I let that kind of guide me. And a lot of times it's really hard when patients are angry or screaming at you. I had one today on the phone who was just upset at his whole situation. And it wasn't at me. His anger was not directed towards me. It was towards the system and his situation in life. And I had to remember that, it's not about me, right? And I think that helps when you're dealing with difficult situations. Remember that it's not necessarily directed at you. It's more so what this patient's going through.
Yeah, no, that's really, really important. I see everyone kind of shaking their head. Is there anyone that has, kind of caught yourself in a place where, you were facing some mental health challenges and you had to remind yourself, like, hey, don't take this personally. This isn't about me. Or you found yourself treating somebody in a way you didn't want to be treating. And, what kind of led you to being in maybe a little bit of a mental health dark place, if anyone's willing to share.
So I don't mind sharing about a time in residency when I was kind of in a dark place. And so there in anesthesia residency, there's a common, a referral to one of your years, your CA2 year, which is your PGY 3 year, as being the CA2 blues. It's like a common condition that third year residents get. And that's probably because why I think it is because residents are more isolated during this year. And so they're doing their subspecialty trainings. They're doing pediatrics where it's just them. They're not working in team settings, say like if they were in trauma or OB where you work in a team setting. So they're not really getting to interact with other residents, other colleagues. And so during CA2 year, it's isolating. And that isolation can really get to you, especially in anesthesia when you're in an OR in the dark for many hours all day long. And that feeling of, I'm a very social person. I have to feel connected to maintain my sense of happiness. And so, that year of being in the dark every day alone was really tough for me. And so I had to just kind of rely on, I should disclose, Aaron is my husband, if anybody didn't know that. And at the time we were not married in residency, but we were together, had matched together. And so I relied heavily on Aaron, and I called my dad every day. I mostly crying, but calling my dad every day, but it was therapeutic for me. And so just leaning on my friends and family. But yeah, that was a time in my life that was very dark.
Thanks for sharing. And does anybody else have a time where they're struggling mentally and experience depression or burnout?
Yeah.
Most.
I mentioned intern year specifically because it was December going into January. We had this odd schedule where you were either on for Christmas or you were on for New Year's. And I just happened to get this 5-week block on the worst rotation that there was in our residency. And it was you walk into the hospital as an intern at 6 a.m., you leave the hospital as an intern at about 8 p.m., 9 p.m. You go home, you eat, you sleep, you develop reflux because you're eating an hour before you sleep, then you wake up again at 5 a.m. And I had an old school resident, and she had suffered through this herself. So she felt that I should suffer through it myself also, and gave very little assistance. Honestly, I reached a point where I didn't handle in a healthy way. I started hiding from her. Like legitimately, I would go write my notes in the dialysis unit so that she wouldn't find me and I could at least get some work done before the next patient was there to be admitted or whatever. So it was not the healthiest way to deal with it. So that was my first run with it, and I just didn't handle it well. Gained a lot of weight, didn't do very well with that. More recently, this last year, a critical care doc, I've never seen that many people die in like just that amount of time. And early COVID, people would die. And you would walk in and you'd be like, well, this person's kidneys have given out, they're going to die. You'd come back the next day, they were gone, or they would die while you were waiting. And that was like a really dark, you're a first year practicing person. And I know even non-first year people, because I've spoken to other physicians after this, were feeling this, because you start to question yourself as in, I've done all this training, et cetera, et cetera. Why are people dying on me? Am I missing something? Am I not doing something? And you start to, I don't know, I was done. I was burned out. I was over it. And I legitimately questioned whether or not I really wanted to do critical care any further. So the last year, I think for me, out of all of my training in medicine, maybe was the tougher one after intern year, as in I questioned myself and I questioned if I really wanted to do this at all. So yeah, for me, that's been the one. That's been the biggest one.
Yeah, thanks for sharing that, Jerry. It's really tough, and I want to come back to what kept you in it. You're on call right now, so you're still in it. So I want to hear what you did to help keep you in it. But I want to give some other people an opportunity. I know Melissa, look, you were trying to share an experience that you've been through.
Well, I had some extenuating circumstances also kind of going into residency, in that my mother was sick at the time with a progressive neurodegenerative disorder. So, going into residency, I had just also the stress of family, and family just stuff going on, in addition to being, thrust into this extremely, stressful and cutthroat type of environment. And, unfortunately, my program wasn't very supportive, and, it was a pretty dark time. I mean, I look at it and sometimes, it's honestly just a blur. I sometimes don't even, I can't really remember much of it. It felt like it was just honestly survival mode, just to kind of get, one day to the next. And I can't remember who was saying it earlier about, Jerry was saying, it's kind of this like lather, rinse, repeat model. You get up at, 5 a.m., go in and make your rounds, and then you're leaving the hospital you're going in when it's dark, you're leaving when it's dark, you go home. All you really have the energy to do is just, eat something and go to bed, and you wake up and you do it all over. And then with, the 4 days off a month that we got, I was where I was training was close enough to go home. So I was frequently driving back and forth, and, it was just, it was a lot. So, it was yeah, probably one of the darkest times, you know, in my career thus far in terms of getting through that.
Thanks. Thanks.
Yeah. Thank you. Yeah.
Travis, Aaron, do you guys have anything, or I'll give you a chance to share before we move on?
Thank you, Aaron. Yeah, I'd say there were multiple times. I mean, really I look back on every year in residency and training, and there are times where you think you're flying and you're learning and you're in the, the zone, but then there are darker times where it's a new rotation, or there's something like Melissa shared, something completely unrelated that is very important in your life that is going on while you're trying to do this very stressful and very time-consuming thing. So, but it's definitely there. And just by asking this question, you can see that everybody has shared experiences. So sharing, if you have a residency teammate, if it's your spouse, if it's your parents, but sharing these experiences and what you're going through really helps. I know my wife is a Tulane alum too, and she's a hospitalist now, and so we share all of our different things, and it's really nice to be able to share that. I think the thing that sticks out to me, Jerry, is the amount, as an intensivist too, is just the sheer. It was helplessness almost with COVID. I mean, I'd come in every day and round in the COVID unit, and there'd be an empty bed because that person died. And sometimes you're like, you understand because they're sick and sometimes you're just like, what happened? What did we miss overnight? You go back and scour the chart. You talk to the family, and then you throw in with COVID that the family is saying goodbye by Zoom. Like they can't, for a year, they couldn't even come to the hospital. And so you're trying to comfort a family through Zoom, and, or they come in and they're just looking through a big glass window, and anyway. So those were really tough times, and hopefully, and luckily here, at least the numbers are getting better, but that was really tough and helpless.
My mind immediately goes to night float. And maybe it's just me, but that was an exceptionally difficult period for me. I had them sort of back to back in terms of months. And there was literally one entire month where Christina and I didn't see each other. Like she would come home, and I'd have left 15 minutes before. And we'd see each other on the weekend for like our one day off, what have you. So just to come back though, in terms of definition, I really think of burnout as languishing. Of course, all these other definitions or explanations are perfectly on point: emotional exhaustion, not being able to recharge, etc. Because there's something to be said about doing a really difficult or arduous activity for a set amount of time, but quite another when there's no change in the horizon, and this is the new normal, and this is how it is. And I think because it's such an insidious process, it's difficult to recognize it right away. It's one of these things you might look back after a certain time interval. It could be a week, could be a month, could be longer. But unfortunately, what we know is characteristic is not necessarily being able to recognize or be proud or stand tall with our accolades, our accomplishments, the good we do. It's more that we get hyper-focused or fixated on the grievances, and we don't have the emotional resiliency to bounce back as readily or rapidly. So this is like excellent for discussion. Of course, I have a ton to share, but I'm keeping my lips peeled until I'm called upon, Peter.
No, I mean, what you share, I mean, that really resonates with me. And when my mentor passed, I really started to read a lot about this stuff and look into it. And I actually found out that suicide rates among orthopedic surgeons has been the highest of any surgical subspecialty in the last 15 years. And I started to read more into it and read about burnout and depression. I was like, oh, I have all of those things. And and then all the times where I showed up to patients, to my colleagues, showed up to my family, my fiance, when I showed up in ways I wasn't proud of, and I would get even more mad at myself or angry at myself. And you kind of go into this cycle that you guys all were talking about. So yeah, Aaron, what you said is really spot on. Kind of transitioning that into like the stigma of getting help. Jerry, coming back to you, it sounds like you were ready to throw the towel in. What made you come back? Did you reach out to a spouse like Christina did, or did you seek any professional help? What kind of things did you do to to support yourself?
It's funny, Aaron said you don't realize it when you're in it. I didn't. So I gave a presentation. I was asked to give a presentation to my fellowship on COVID-19 in New Orleans because it was pretty bad here at the time. And we were pretty busy, and they do this COVID symposium, and I presented on it. And like in it, I created this PowerPoint. And somehow it became my stages of grief while creating the PowerPoint. And I legitimately presented on my stages of grief. And that was the New Orleans COVID experience. Then afterwards, when people started calling me and being like, Jerry, are you okay? That's when I realized, oh, by the way, they asked me just to present on COVID in New Orleans, not am I burned out or tired or depressed. And I think the most helpful thing, the way I got out of it, was colleagues reaching out. It was specifically after that presentation, and talking to other people and hearing from other people who were going through the exact same thing. That really actually helped me a lot, because there was a lot of self-doubt. And the more you doubt yourself, the more there doesn't seem like there's light at the end of the tunnel, the deeper I fell. But then when I spoke to other people, I feel that really very much helped me and helped me to get out of it. I didn't seek help. I just spoke to colleagues. And yeah, I was out of it after about a month or two of just talking to people and disclosing, hey, I was done. I was depressed. I was burned out.
Has anybody here seeked out any professional help or worked with anybody other than just speak to colleagues?
Well, yeah, but it's a loaded question, because I'm in the field. But I mean, it's part of our like mandatory training, or at least it was in residency, where a lot of us have things to do. We felt as though we were busy a lot of the time. Who has time in the schedule to get together for weekly meetings as a group to hash it out, give each other tips, process, validate, work through some of these stressors? I'll tell you, it's the best thing ever. And I may be getting ahead of myself in discussion points, but those weekly meetings that we had in residency not only helped us to like learn how to do things better, but we felt more cohesive. We would cover for each other more often. We could lean on each other. I mean, it was a major asset to the program.
So what was the structure and the ground rules? Or was every single week? Was it everybody in the residency program? Were people given time off in their clinical duties? Like how does this functionally work? I mean, in orthopedic surgery, what you're talking about I don't know whatever exists. So yeah.
And as a former chief, I can tell you schedules are tight. People are needed everywhere. I mean, there's not much room to give for, an extra weekly meeting. So we would generally add it on to like a didactic day where we're all planning to be together anyway. We ultimately did have it embedded into the curriculum. And so we'd have designated time. We did have different moderators come. Various psychologists would come. People taught us like gradual relaxation therapy. Others would bring up, things related to like CBT just to increase awareness, not for lectures. This was for us as a group. So the point is, at the beginning, there was a lot of pushback. Hey, I have notes to do. I can't, spend time here, XYZ. By the end, it was like the most valued portion of our didactic days, looking over the year, like looking in retrospect.
Last question about that. Who championed that? Like who pushed that? I mean, if you could like try to come up with a way for that to be put into all of our other specialty programs, I mean, how does something like that get established?
So it did come from the top down in our case, which was great, from our program director. It was one of these things that we are doing. And again, we're in psychiatry, so it's appropriate. We need to get a feel for what it's like and also be able to deliver it. But quite frankly, we were heavily unionized in Miami, which is another topic entirely. And so advocacy groups were able to make changes, effective changes. And this was, part of that as well.
Does anybody else's either residency programs or where you guys are working now, do you guys have any positive structures like that? Or on the flip side, is anybody's, culture that they work in, for instance, I would say mine, would be very much against something like that, and it would be an uphill battle. And why do you think that is?
Well, I mean, I know for one thing, when you're, applying for any sort of privileging or, anything that we have to file for these days, you have to disclose any history of any sort of, treatment for depression, whatever, substance abuse, and certainly while it's understandable on the liability standpoint of things, I think it leads to much of the stigma, because in our profession, where we know that depression, anxiety, substance abuse, it's rampant, and yet then if and when we are able to actually come to terms with it and then do something about it, though, then you have to live with the fear of it kind of following you the rest of your career. So I think that's my take.
Travis, you have something to say about the program you guys have?
Yeah, we don't. I'll say, as in my intensivist group where I work now, we're like a busy community hospital. We're very good at sharing and kind of coming together, and we have kind of weekly meetings. They're educational meetings, but we just had a burnout lecture and talked about it. And you just start talking and everybody starts talking. So we do have that. But I want to go back and just say that I did seek help. I went and talked to someone, and it was the best thing in the world. And it took a while for a lot of the reasons, but I did. And I went, and just to have somebody there listen and to talk and to go over, and you're not just going over whatever you're feeling isn't all from, and Aaron knows this, but whatever you're feeling and going through this isn't just the now, it's the years and years and years that led to that. And all just kind of you rehash kind of your high school, middle school, excelling, your all these pressures that you've faced forever. And just to kind of talk about it, think about it, work through it yourself with somebody else. It was, I cannot recommend it enough. It is, I think every doctor should do it once a week. You should, it should be like mandatory, because it changes the mindset. And there is a stigma. It is crazy that you have to put that you sought help for depression or, anxiety on a medical. They should commend you. They should put your thing to the top of the stack, because you're taking care of yourself so you can take care of other people. But I'll step off my.
In some ways, it's like if you have never faced anxiety or burnout, then you probably might not be working hard enough to really take care of all of your patients the way they need to be taken care of. It's a sad truth. And Travis, I'm with you. I still do therapy monthly. I've worked as a life coach for the last 2 or 3 years. I think those things are completely invaluable. And I agree, it's something that I think as health systems, as we kind of grow into this more corporate medicine, it should be the responsibility of some of these health systems and our practices to supply executive coaching for all the physicians. There's actually, I was doing some of this work looking into this stuff. There's one actually really interesting study that they took a group of residents and they gave them pre-scheduled counseling. So every resident in the program was scheduled for weekly counseling. They had the opportunity to opt out if they want to. And the thing was 73% had never used counseling before. And after it was done, 86% of them not only said that they wanted to continue counseling, but they asked their programs to continue to schedule it for them so they could go every single week. So it is something that it's interesting, we all really want and we can benefit from, but the stigma is there. Anything else just in terms of stigma, of, even from yourself, or you've seen, colleagues act or say certain things that just kind of take you aback about how against maybe some doctors are about seeking help from other doctors?
So Peter, I think sorry, Erin. I think it comes down to, there's a major problem with the culture of medicine when it comes to being, essentially, we're all expected to be robots, right? You don't get affected by the sight of blood. You don't get affected by dying patients in the ICU, because God forbid you cry with a patient or, have any sort of emotions towards their suffering. And it's you're rewarded for being callous and being able to like keep going to the next and keep going to the next. And like, yeah, this like hierarchical, like patriarchal culture where the physician knows best and you're supposed to just do what I say, and not really feel for what the patient's going through. I feel like that sort of spills down from the way medicine kind of used to be practiced. Maybe nowadays we're starting to all realize that this is not the best approach, and hence having conversations like this, and hence the awareness that burnout is a thing. But yeah, I think and a lot of it comes is a problem with even the way we speak. Like I think every med student, once you get through medical school, you will have at least come across people calling patients dumps, train wrecks. Somebody is a black cloud. It's all this very negative speak and cynical speak, and that just, it's pervasive. And so I forgot what your question was, but that, that was my soapbox. I think it comes down to like this problematic culture that we all perseverate.
Yeah, that's very, very well put. I kind of want to just open that up just from each of our own specialties, sees it differently. I mean, does anybody else just have their kind of soapbox of the culture that of their specialty, subspecialty, and their because like you said, there's this whole patriarchal culture in medicine in general, but when you get into the weeds of each specialty, it gets even like darker and more complex to deal with. So just kind of open it up to anybody else to chime in.
Emergency medicine and critical care have both I think if you look at all the doximity lists, they're kind of 1 and 2. And so in those specialties, they have really started talking about it. And like Christina said, and I just pointed, I actually have no idea which way Christina would be on everybody, but anyway, but she's that way on but like Christina said, the old kind of society of medicine, we can change that. And this is our generation of medicine. And so we can start talking about it and start saying it's fine. It's fine if you go see a therapist. It's fine if you're sad. It's fine if you had a rough day and you need to talk about it. So I think we can change that. And from my specialty's perspective, they're starting to. I mean, it's starting to be more recognized. So just talking about it and changing the narrative will help.
Melissa, from an OBGYN's perspective, especially compared to orthopedics, which is still very alpha male dominated, you're in the complete opposite of that. I mean, where does that culture show up differently? Inherently, you would think women would support each other more than a bunch of orthopedic men do, but how does it show up for you?
Yeah, well, I mean, I don't think it's a secret that OBGYN is kind of a notoriously catty field. I mean, one, it's just a lot of estrogen. It's female patients, it's female nurses, it's female physicians, and it's kind of sort of the rite of passage to be a young female physician and to kind of get beat up and beat around by anyone and everyone who has any sort of seniority on you in terms of experience, whether that's nurses or your colleagues. And I'm kind of in sort of unique circumstances for our generation, which is that I'm a solo practicing OB, and you don't see a lot of that these days, which on the one hand, I'm very, very grateful for the autonomy that it affords me, and that really is honestly the best part of my job, and it allows me to really be able to care for my patients the way that I want to, but it also is very lonely. I mean, the model of obstetrics and gynecology these days has gone far more to the large group model, or many, out here in California, the Kaiser models. and it, you kind of get that sort of strength in numbers behind you of a group setting. Whereas, when you're kind of out there and you're sort of fighting all these battles on your own, it can start to become, it feels very exhausting.
Yeah.
Yeah.
Aaron, it seems like you guys have all these weekly meetings. You guys have figured it out. I mean, how can we, some of these other specialties, start to apply what you guys have worked on, and also within your guys' field, what are you guys still struggling with? And I would imagine you guys are the furthest ahead of us. So, what are you guys still struggling with in terms of mental health and taking care of each other? And what can we learn from that?
So just to be frank, it's very real within mental health. I mean, amongst psychiatrists, burnout is very common. Emotionally draining, as you might expect. You're going from one case to the next. These are extremely dire situations for a lot of people. There's a lot of angst, distress. How do you compartmentalize that? How do you unload that, those types of stressors? And so this is where the compensatory behaviors come in. Is that you call a friend, you hang out, you go for a walk? Is it that you go swimming? Is it that you read a book? So the problem, I would say, is that we get so caught up in our goals, and arguably all of these, professionals are well-to-do and go-getters, et cetera. Driven is what I mean. But at times it's important to recognize our own limitations. And this was a big challenge for me personally, is setting boundaries. I mean, sure, you have an offer to do like a book chapter, or you can give another lecture, what have you. But I think the better we can observe for setting these boundaries, where we would then leave room for more socialization, communication, whatever hobbies, whatever it might be, it's extraordinarily protective. Because the goal would be to have that on an ongoing basis, not that you in 2 weeks will have like one half afternoon off. Maybe it's an hour a day you're spending doing whatever it is, crocheting, I don't know, So I'm a fundamental believer that in terms of being content, I won't speak to happiness because that's a different topic altogether, but being content, one need to apply themselves. You need to have some kind of endeavor that you're wrangling and you're working on. But you also need to have some sort of connection. For most people, there's a few personality disorders where you don't, but a connection with others, sharing, being able to be vulnerable, letting the guard down. And then of course, having your own passions. Doesn't have to be related to anyone else, but just things you like. It could be Westerns, for goodness sake, it could be good Sudoku. So, the point is, those would be important keys that I would encourage people to put into practice early in their training or developing professional career. Because what we find is they're the easy things to cast aside. They're the things that are easy to drop. They're the things that, don't take precedence in life. But that's sort of the exercise for your mental well-being, is keeping them up, keeping them active, making sure you are connecting, even if it's a phone call. So for us, in terms of organization within the program, we did, for like psychoanalytic, psychodynamic therapy, what have you, we did have weekly sessions. I would see an analyst as part of my training. We talk about us, we talk about cases. And my long circumstantial answer to your question is, I think at the very least, having a mentor, someone who's been there, gone through it, a guide of sorts, someone who can check in, hey, is this really going okay? Is this not? Can really help us understand where our throttle should be. Is it too much? Is it too little? Maybe we need someone to help give us perspective in terms of, I might need to make some adjustments in my life, because if I don't, something could happen, something catastrophic could happen, or I might just lock up and not be able to keep going.
If I can add to that, Aaron, I think one thing that I kind of had to sit back, early on, was to really try to sit down and define what my values are and what drives me in my career of medicine. And for me, from even long before I even was accepted to medical school, it was always about having, that interaction and that level of human connection with people, and being able to help them through, and in my case, the vast majority of the time, I'm getting to deal in very happy circumstances. And so, when I hear Jerry and Travis, talk about, or even Christina, for me, I knew I was not really cut out for, the heavier hitting fields. Now, every now and then, we have unfortunate outcomes in obstetrics, but for me, the way I looked at it was that, it's something that I'm able to walk them through. And that part of that, the medicine for me, I decided very early on is that's what fulfills me. And so I have to hold on to that and I have to latch on to that. So for me right now, I run my own practice, which just running an office and all of that is enough headaches that I could take up the whole hour. And then, being a solo practicing physician and then dealing with, hospital administration stuff and all the other, BS that we have to deal with on a daily basis. And, people say, do you think you'll join a group or do you think you'll do this? And right now for me, I would much rather have, the autonomy to be able to run things the way that I want to and not be beholden to, a group setting where, I'm going to be, living and dying by RVUs and being told by administrators how many patients I have to see and how much time I have to spend with them. And so I think that for me was a very important step that I took early on to kind of say, listen, right now, this is what keeps you happy in your job and this is what fulfills you. And so you have to hold on to it.
Yeah, totally. It's balanced. Like, and it's kind of what Aaron was saying with, striving for your goals and setting boundaries, knowing, hey, this is what's the most important thing to me. For you, it's autonomy. And then realizing, because of that, you're going to have certain struggles in a couple of places and just being okay with that and being, like Aaron was saying too, being open with being vulnerable of saying, hey, this is not going to be perfect. And you're okay with that. You can share that, openly with us. So that's great. A little bit more about, we'll take questions in 2 minutes. We'll do the last 5 minutes of questions. But I kind of wanted to touch on vulnerability. And Aaron, I'm really happy you brought that up. I think, as doctors, we forget that we're also humans and that we make mistakes and that every case is not going to be perfect. And, Jerry, I wonder, it sounds like you really have gone through a lesson of vulnerability, especially through the pandemic. Is there anything you can share about, becoming more vulnerable and being more comfortable with that?
Yeah, absolutely. I agree. We're human. It even getting to the point of, it's easier to say, oh, I'm burned out than to say, oh, I was depressed, right? Because I don't know, there's that you're fearful of that certain stigma of, oh, I was depressed, and I was. Saying it in front of however many random strangers, but I was. So I think this last year, I think one of the things, once you reach that low, having people that reached out to me, and maybe I should have sought counseling at the time, but having friends reach out to me really helped because they saw it in me before I was ready to say it. And then once they started saying it to me, I found that the more I said it, the easier it became, and the more I accepted it, and the readier I was to actually deal with where I was from a mental standpoint. So saying it repeatedly actually really helped. Like friends who are random that I went to college with, I'd be like, man, I was in this really dark place, and just talk to them about it. They may not have wanted to hear it, but I kept saying it out loud. And the more I said it out loud, the readier I was to deal with it. So I think the first few times it was people realizing it in me, but then after I had said it out loud, I felt empowered to be able to continue to say it. So that's what I learned in the last year.
Wow, that's amazing. I love that you talked about, burnout and depression and are they actually separate? There've actually been a couple of studies looking at the symptoms of burnout of depression, and when they do like a cross symptom analysis, it's actually shown that there's not a significant difference between the two definitions, and that suggesting that maybe by separating burnout and depression, it makes it a lot easier for us to say, oh, I'm burnt out and it's not that big of a deal, when really you're on a spectrum of depression and it's something that we should take more seriously and really deal with. So I'm really, really happy you said that. That's spot on, and I hope everybody thinks about that and uses burnout as more of an alert to get help early, so it doesn't catch up to you. Thank you guys so much for everything. I want to touch on, there's a couple questions that are coming in, so want to touch on those real quick. Holly asked about student debt. Has student debt added any extra stress that can exacerbate burnout?
Well, we all graduated with Tulane loans, right? So,
Yes.
God, yes, it does.
Yeah, so we're hoping for the Tulane burnout repayment plan coming up in 2022.
Yeah.
Another question we have from Elliot Flom. Elliot he's a non-medical professional and also in a high burnout industry. He wanted to kind of get a better sense of, and do any of our hospitals provide resources to combat burnout? And is it widely accepted, or is it integrated into our culture that burnout is just the norm? We're just kind of interested in how it works with us. So we kind of talked about the cultural aspects, and if anyone wants to kind of talk about specific resources that hospitals have, in my experience, it's there, but it's not very well utilized. But interested if anybody else has a positive experience with it.
So I really think it's, sorry, go ahead, Melissa, go ahead.
No, go ahead, Christina.
No, I was just going to say, and I'm sure you're going to say it really depends on the hospital and the institution. I think maybe academics, they will lean more towards providing lots of resources for burnout. I am very biased at my institution. They have excellent resources for physicians. They have something called EAP, which is Employee Assistance Program, which means it's essentially free counseling for anybody in the whole institution who wants it. And I think a lot of other hospitals do offer this. Whether people take them up on it is, like you mentioned, Peter, kind of relates back to like the stigma of seeking help. But for their part, at least the hospital part, they make it anonymous. It's not providers that you're going to be working with. And I think that's really key, so that the providers that you're going to be seeing, the psychologists, counselors, whoever, are not going to be the ones who are actually, you do like a side consult on, right? So again, I think it depends, and maybe Melissa has a different experience.
Well, I think with respect to my training program, I mean, our idea of a resident retreat was, a Friday of where we got, 9 hours away from the hospital. We still had to come in the morning and make rounds, which meant we had to get there earlier than normal. And then the night team was coming back at night, and it always felt, like this was supposed to be them kind of dotting their I's and crossing their T's to say, oh, we're giving you some. I think programs in general, just from what I'm seeing these days now, are getting a lot better about it. And ACOG, which is, our sort of American College of Obstetricians and Gynecologists, even has like an ACOG wellness week that they dedicate. But one of the hospitals that I'm privileged at, actually has a designated physician well-being committee. And in fact, I had 2 years ago an unfortunate fetal demise at 41 weeks, which was just, it was awful. And I mean, it for me, obviously for the patients, but I mean, the hospital was, I have to give them credit. They were on top of it. They had everyone reaching out to me, offering resources, connecting me with therapists to kind of talk through it. So I think we're starting to make some strides in the right direction, but, it also goes beyond, saying, oh, let's have a week where you guys do a yoga class and you go do this and you do that. It needs to start really seeping more into the general culture of medicine. We're not even close to getting there yet.
Yeah, I completely agree. There's one question I'm very happy to end on. It's a great question. I will, before I get to that, I want to do some quick closing remarks, and then for people who are still interested in staying on, please stay on for this last question from Mark Brenner. But for people who are listening and tuning back in, this is being recorded. So if you're turning back into the recording, there are plenty of mental health resources available from the Tulane School of Medicine for students, please reach out to Dr. Karen Weisbecker. She's the Director of Student Support and Wellness. You can always contact Tulane University's Counseling Center. 504-314-2277 is their number. And so I just want to make sure you guys get those resources for people who are still here. So one really great closing question from Mark Brenner, for those who want to stay with us. Mark asked, do you consider being a physician a career choice or a lifestyle choice? And are you pleased with your choice to be a physician, considering the toll that it can take? And where are you given any preparation for burnout issues? So we talked a little bit about preparation, but was this a career choice or a lifestyle choice? And are you happy with your choice? And if where you haven't been, maybe where are you working to move the needle so you're becoming more happy with your choice? Aaron, you want to start that?
Love to. Always happy to talk. So I should say, I think initially it's a career choice, and I think that I'm sort of satisfying other administrative expectations in order to fall in line, kind of like what Melissa had said, I'm in the machine, so to speak. But it would be a great goal, long-term goal for me, to have it be a lifestyle choice. And I think part of that would include, not having to rely on certain income things or other sort of expectations that I'm getting from my current position. But with that in mind, I should just say that it's something that I've always wanted to do. So it's not something I just found. Went to medical school for this reason.
Thanks. Jerry, how about you?
Yeah, still a career choice right now with that Tulane-sized student debt and everything. But I'm hoping it'll become a lifestyle choice for me also. I'm 5-10 year plan is to make it so that it actually works for me, and less so that I just have a job. Not quite there yet, but that's the goal.
Travis?
So I agree. It is a career choice. I don't think you can spend that much time in just reading first aid, and if you have friends that are outside of I said first aid, I had to bring it up. So, but studying for all these steps and doing all these things, especially if you have some friends outside of medicine and you see them, they're like off every weekend and they like get off work at 5. But I was thinking about it today when I picked up the phone. We had a patient that did really well, and I called the family and they just said thank you for like 10 minutes. And so it just, and this is it's fun, it's intellectually stimulating. A lot of things are fun. Procedures are fun. Saving lives is exciting. And it's a good mix. I didn't come up with this, but medicine's a mix of science and soul. And it's really, you have science, but then you have this kind of, the art of medicine, and you learn something new every day. Some of my friends in other fields, which will remain unnamed, say, you learn every day and you're excited to go to work. And I'm not always excited to go to work at 10 p.m. on a Friday night, but like most of the time I am. I think it's a career choice, and I echo the hopefulness to sleep more nights as the time goes by, and have maybe a better lifestyle. But it's definitely, in my opinion, a career choice.
Melissa?
Yeah, I think actually, touching back on kind of, that decision early on to try to define for me what my values were, right now it feels like a lifestyle for me. It probably started off as a career choice as well. But again, going back to my particular practice model, which is, allows me to be extremely, extremely invested in my patients and have, really, really just very close attachments to them. It honestly, it makes me not resent the middle of the night, 3 a.m. deliveries that I'm getting called in for, because they're my patients. And I feel a sense of ownership, and I feel a sense of, connection. And it, again, is what allows me really continue to enjoy what I do. And it's, I always say it's those moments and those wonderful deliveries and, the patients afterwards that are just like, you're such an important part of our family now forever. And, also talking, I can't remember who brought it up earlier about, how we're ingrained. It's just kind of in our nature to only focus on what we do wrong. Right. And my dad had said that to me years ago that, what's our training like, right? You're on rounds, you're getting pimped, you're not, for every 99 things you do correctly, the one thing you do wrong, you're getting just, crucified for. So it's in our nature to only want to focus on the bad stuff. But, there's a lot of days where I have to sit there and remind myself, there's a lot of really good. So, I think it started off as a career choice, and for me right now, it feels like a pretty reasonable lifestyle choice. So,
Thanks.
Yeah.
I'll kind of chime in for this last one. I think for us, our profession, our career is very unique because it kind of is our life. We spend, a majority of our life preparing for it, to get in, to go through all this tests, the first aids, whatever. I'm about to take the boards in a couple of weeks, another test. It really is our life. Our career is something that we're going to be doing for our entire life. And to think the struggle that we've all talked about tonight is, trying to close the gap between, career choice and a lifestyle choice, and find that balance that works for all of us. Because whether we like it or not, this is our lifestyle, and we have to form those boundaries that Aaron talked about, and to come to a place where we're comfortable with it and can support specifically really support each other when that gap grows. So thank you guys so much. It was such an interesting conversation. I definitely benefited from it. I hope all you guys did as well. And please, if anybody else has any other questions, please feel free to reach out to me. I know that anybody else in this panel, we're more than happy to talk to anybody about anything you're going through. We all really need to support each other whenever we need it. And so we're always here. And so thank you very much. You guys have any other closing remarks? Just thank you guys so much for your time and for your words.
Thanks for having us.